Hi there, I'm Sonal Mehrotra Kapoor and welcome to the Money Control live stream. Now, as 2022 draws to a close, the scare of COVID has somehow come back. There are pictures that have emerged from China which paint a very grim picture of what exactly is unfolding there. But remember, it's China, so there's only little information that we have. Cut to rest of the world. Japan, China, US, South Korea, Brazil are all reporting COVID cases. Not at an alarming number, let's tell you that, except China, but still these numbers are coming in. When it comes to India, the numbers are relatively low. They stand at around 4 at the moment, seen in two states. Right now, all patients recovered, but the government is at this point holding a meeting as we speak. The Prime Minister, the Health Minister, all of them are sitting down to understand what next and how should India prepare. So as these pictures emerge of what's happening in China, sort of a grim reminder of what happened in India during the second wave, we thought, let's sort of decode for you what exactly does this mean. Not social media rumors, not something that can, figures that have been going around about 1 million projected deaths, etc. But what exactly does it mean for you and I as we get into the holiday mode? Joining me now is Dr. Guleria. Dr. Randeep Guleria needs no introduction. Very glad to have you on the
Thank you.
program today, sir. We've been speaking on COVID for about 2 years, but who would have thought that yet another December and this is where we will be? I want to break down this discussion, sir, into two bits. One, understanding on what's happening in China to get to why they are where they are, and then the impact on India immediately. I'll begin with China. So at the moment, it looks like from the pictures that have emerging, grim pictures really, that it's almost deja vu, at least for us, from the second wave. People on the floor, people are on everywhere across the hospital beds, people in homes not getting food delivery, and a lot of confusion over what exactly is happening. What do you think are the factors that have led to this? Because here we were thinking that, hold on, the world has reached herd immunity, vaccines are everywhere, but China, a very different story.
Yes, that's true. And I think you rightly said it that China has a different story. And I think it's related to three major factors. The first factor being that China started off with a zero COVID policy. What that meant was that even if there were very few cases of COVID, even if they were mild cases, they had a very strict lockdown and would not allow the infection to spread. Now, that would have been useful in the early days, but I think that has now become more counterproductive in the later days because once the virus started spreading in a milder form and was causing a mild illness, it could spread in the population as it has done in the rest of the world. But because China had a zero COVID policy, they have a large part of their population which has never been exposed to the virus, which is now getting
Hmm.
exposed to the virus for which they have no immunity. And it's like what it was in 2020 when the other parts of the world were getting exposed to the virus. This is what China is facing right now, a large population which is naive to the COVID virus. Secondly, I think the issue is if their vaccination. They have had a vaccination which are vaccinations made in China itself, but there is really no data as to how effective they are against the new variants, and it seems that they are not working effectively as far as the new variants is concerned. The third thing is that the vaccine uptake is also low in that country. If you look at the vaccine uptake in the elderly population in the high risk group, it's only about 50 to 60%. So a large number of the vulnerable population is either not vaccinated or has a vaccine which is not effective or has no natural immunity. This combined with the new strain which has hit them, the BF.7, which is very virulent, which spreads very rapidly, has a R naught of 10 to 18, and has a lesser incubation period. It has led to this infection spreading like wildfire in that country, and they're seeing a huge surge in the number of cases. And because there's a surge in the number of cases, and especially the high risk groups are not protected, they are seeing more hospitalizations also.
Yeah, so two primary reasons you mentioned. One, there is no herd immunity. And second, the coverage of vaccine itself is under question of how much population came under that. And then the effectiveness of Sinovac as well, as we know very little about that vaccine altogether. Just for a context here for our viewers as well, the Chinese government lifted nearly a 3 year long lockdown just a couple of days ago after massive protests were seen. And immediately after that, we've seen this fallout. So this does tell us a very sort of immediate impact of what you have been talking about for the past 2 years of achieving vaccination goals, of achieving authentic vaccination goals as well. That's clearly the message here.
Correct. So I think the most important thing here is that China should have prepared for what could happen once they lifted the zero COVID policy, looking at what things are. They should also have pushed aggressively for vaccination and done a little bit of homework as to the efficacy of the vaccine. And if it was not working, there are now enough vaccines available globally, and they could have got these vaccines for their population if that was needed, rather than sticking on to their own Chinese vaccine, the Sinopharm vaccine, which the efficacy of which is still debatable. So I think that was the mistake that they made, and that is why we're seeing the situation that is currently evolving as far as China is concerned.
Exactly. So numbers emerging talk to us about hardly one third of the population in China actually being covered with vaccinations. That's also in major big cities, and smaller ones are a different story. But talk to us a little bit more, Dr. Guleria, about the BA.1, highly virulent. Something because India is vaccinated, we're seeing a very different trend emerge here of the same variant. But in China, as we see, it's leading to deaths.
Correct. So, like I said, when you're looking at the new variants, these are all variants from the Omicron sublineage. And the BF.7 and the others have all originated from the Omicron variant, which emerged last year in December. We have been lucky that we've not had a new variant like we had the year before that. We had the alpha, the beta, the delta variant, all coming from different lineages. So, what that really tells us is that this is a variant where if you have immunity against that, that you have immunity against the Omicron variant, you may still get the infection, but your immune system, which is geared up and has antibodies against this virus and this variant, will not allow it to cause severe illness, will not allow hospitalization, and will protect you against deaths. And that is what we're seeing. So we're seeing that although in certain other parts of the world the cases may have increased, they are not really causing more hospitalization and death. And in India, we're not even seeing increase in number of cases. This new variant has been reported. Four cases have been confirmed for some time in the last 2 3 months, but we've not seen a surge in the number of cases or hospitalization, despite knowing that this is very infectious and can spread very rapidly in the population. So our situation is different from what is being seen in China.
Correct. Last question on China, really, before I move on to the situation in India and how we should really be preparing at this point. Some very wild numbers have come out, and one wants to get a perspective on this. Reports have been suggesting how 1 million projected deaths will take place in China through 2023. There are others which say 1.6 million may die because of COVID in China in 2023. How are you reading these numbers?
So I think we need to be a little bit careful about how we read numbers, because these are modeling data. And we know that modeling data has a lot of variables which have to be factored in. And that would depend on how the virus behaves, what is the degree of immunity, and what precautions or what measures the government brings into place subsequently to control the outbreak. So these are figures which may have a large range, if I may put it that way. And I would really want to see how things evolve rather than saying that this is exactly what is going to be happening, because this is modeling data which will change over a period of time. So I think the next few days or next few weeks will tell us how things have evolved and how China responds to all of this. We really don't know what they are going to do when they see this. Are they going to bring the lockdown back? Are they going to do something else? That will also change the whole scenario in terms of numbers and the modeling that is being done.
Also, will we ever get to know what's really happening there? That's been another concern.
That's
We don't
correct.
Yeah, because the number of deaths, etc., reportedly said to be much higher than what the government has really talked about, and they've not tagged them as COVID deaths per se. So that's really going to remain a gray area when it comes to China. But moving on to India now, like I said, this has been quite a bummer in the plans for New Year's as people were preparing to travel, actually get back, look forward to 2023. There you go, another scare has come in. But would it be safe to say at this point that as long as you are fully vaccinated with or without the booster, and you are taking precaution in public, that is wearing a mask, ensuring you're not mingling too much in public spaces and crowded spaces, there's no need to panic just yet?
Yes, I think if you have been fully vaccinated, although I would say that if you are and if you're due for the booster vaccine, you should also take the booster vaccine. But a large number of people have got natural infection and have recovered from that. Therefore, there is a good amount of immunity which is both vaccine related and related to natural infection. So that is giving our population some degree, or I would say reasonably good degree of protection. And if along with that you follow COVID appropriate behavior and you are a little careful about not going to indoor places which are very crowded and where there can be infection, and you don't, if you're not wearing your mask or you're not doing hand washing, if you do all of that, wear your mask regularly, wash your hands, be careful about where you're going to, I think we should you should be all right, and the cause should not be really concerned. Remember, you can still get COVID, but by and large it will be like a flu like illness. You will have fever, cough, cold, body aches. It's not going to be like what we saw in the Delta wave, where you had people got severe pneumonia, the saturation really crashed, and you needed high flow of oxygen, you needed ventilatory support. That type of situation seems unlikely as we move forward into the new year.
Right. So essentially, you are saying get back to COVID appropriate behavior, follow all of those things that we have learned the hard way, perhaps, learned to put on our mask, learn to stay away from very crowded, locations. If you're feeling ill, always ensure for your safety and others that you have that mask on. And you're essentially saying that as long as you're vaccinated, there is a blanket of cover. Of course, there is no absolute immunity that comes from the vaccine, but there is, perhaps it'll keep you out of ICUs. It'll not lead you to be extremely sick. That's essentially what you're saying. So the next question probably that comes to mind is, then what about international travel? Right now, a lot of people are thinking about traveling abroad. This includes countries where these cases have been seen. This also includes countries which do not have such a terrific track record like India of vaccinating a majority of their population. So, in those places, if people are traveling with, say, kids and elderly, what should one be doing?
So I think this is a question that one will have to see how things evolve. But I would still say that you could continue to travel as long as you follow COVID appropriate behavior and you're vaccinated. You have to be careful. The issue, of course, is how things evolve over the next few days. Currently, if you look at the situation in most parts of the world, we're not seeing increasing hospitalization, we're not seeing increasing in deaths, and we may see an increase in number of COVID cases, but they are by and large mild cases, just requiring some degree of symptomatic treatment. And thereby, I think it should be all right. But one would want that you take precautions, because if you're going on a holiday and even if you get a flu-like illness, you have fever, body aches, it will spoil your holiday. So better to be careful, get yourself vaccinated, follow COVID appropriate behavior. If you do that, you would be able to enjoy your holiday also.
Yeah. So, what does one do as immediate? I know a lot of people watching right now are packing their holiday bags and want to keep some medicines handy. You know, Indians, we always love to travel with lots of medicines when we go abroad. So, one should switch back to antivirals, remdesivir, etc. Should be back in your, or how does one approach this in case you have fever or any symptom?
Currently, it's predominantly symptomatic treatment. The
Hmm.
number of patients who are being admitted requiring antiviral drugs like remdesivir or steroids or drugs like tocilizumab is actually almost zero right now. We are seeing predominantly most of our patients who turn out to be COVID positive being given symptomatic treatment, paracetamol, some treatment for cold and cough like anti-allergic or antihistaminic treatment, and supportive treatment like multivitamins, maintaining their hydration. and they recover in about 5 to 7 days. So most people, I think, don't need to panic or worry or start hoarding drugs like people had done in the past, because if you are vaccinated, if you are having some degree of immunity, then the current strain of that we are seeing, although more infectious, having a higher chance of causing infection, is not causing severe infection, not causing hospitalization, is not causing deaths as far as our population is concerned.
Right. And those who are more vulnerable right now, Dr. Guleria, we've spoken about how vulnerability also changed variant to variant. There was those who were immunocompromised, then there were those who were under treatment or were taking immunosuppressants. There were different categories really that built up over a time. At this moment, who would you say is the most vulnerable?
So the elderly are the most vulnerable, those who are, say, over the age of 80 or even the older age group, 70 plus, and they have to be extra careful because we know that with rising age, your morbidity and mortality goes up significantly, and therefore, if they are planning to go out or travel, then they have to be extra careful in terms of wearing their mask properly, avoiding areas which are overcrowded, and especially areas where there is a lot of chance of spread of the infection. So what I would really say is that they need to be careful, and so and then you're, as you rightly said, those who are immunocompromised, who are on chemotherapy or whose immunity is low, need to be careful. So I think prevention is better than cure, and
Hmm.
if these individuals have not taken their booster shot, then they should come forward and take it, because that is also happening, that many individuals now feel that COVID is more or less over in India and they don't need to take the booster shot, and that's something that a lot of people have not done. I would suggest that it will give you protection as far as the new variants are concerned, and therefore you should actually take your booster shot also.
Right. So, two important things that you've mentioned here, which I think is a bit of a relief to those watching right now, that it's okay to travel as long as you are fully vaccinated and have taken your booster and are following COVID appropriate behavior. Elderly need to be extremely careful. That's another point you've made. But the third one I want to get to, Dr. Kuleria, now, because some worried mothers are sending questions, and I want to just address some of them about kids. The entire process of kids getting vaccinated, the government came down to it. We saw it a little later in 2022, and even earlier part actually of when kids started to get vaccinated here in India. But still a lot of ambiguity. By the time COVID had settled, overall Omicron had did not have that same level of putting people or making them as sick. So they restrained. So what should parents be doing right now when it comes to kids?
So I would just say two things. One is, for children, we already have a good immunization program. Parents get the child immunized for various diseases, including diphtheria, pertussis, tetanus. So they should also, in a similar manner, get the vaccination for COVID for those who are due for it. And at the same time, need not have panic or worry, because we also know from whatever data we've seen over the last 2.5 to 3 years, the children get less severe infection. And it's in our data that we saw our admission, only those children who had an underlying immunocompromised state had more severe infection and were getting admitted. Healthy children, by and large, were having a mild infection. And the current data from the new variants does not suggest that it is behaving in any way different as far as children are concerned. So, no need to panic. It's not that it's going to cause more severe disease in children. We don't have data, and I don't think that is the case. We've seen all variants causing a milder illness as far as our children are concerned. But as we get other routine vaccinations done, we should also now include COVID in that plan, and children should get their COVID vaccine.
Vaccines as well. There's another question that I want to address, Dr. Guleria, something that has been doing the rounds on lots of WhatsApp groups as well. So good to get your perspective on that, where people saying that, COVID kids who were born during the pandemic time, largely stayed indoors. And there's this entire theory that has emerged around these kids on how, because they were not exposed to a lot of stimuli outside, they ended up becoming a little more vulnerable, say, than the rest. Now these kids are out and about, and parents are again beginning to wonder how to really approach travel, how to approach school, how to approach games, and finally the winter as it comes here in North India at least. So what do you want to tell them?
So I do agree that COVID has had the COVID population or COVID children, if you may put it that way, have stayed indoor, and that's helped create problem from them, or even from the social development, if I may put it that way. The
Yeah.
interaction that you have with your physical interaction that you have by going to a park or talking to your friends became more and more virtual, and that had an effect. So I think I would actually say that we should just focus on trying to encourage them now to go out, socialize, and the data that their immunity is low because they were indoors for a long time is not that not strong enough to really say that. So as far as if the nutrition is good, they've got all their vaccination and they are healthy, we should encourage them to socialize more, because it is important for their social and mental development that they start physically interacting. And many children have not done that for 2 years. They've been just sitting in front of a screen and going, and that is what they think is all what school is all about. So we need to change that. And I think parents should not get worried, but encourage children to really go out. Be careful. We need to follow the normal precaution that we do for adults. We try and do that as much as we can for children also.
Right. Coming to symptoms, Dr. Guleria, BA.7 that we've been speaking about, any specific symptoms do we see in this case? Some people are writing to us saying that it's led to a widespread throat infection, which doesn't seem to go for a really long time. One person, Speedy Singh, writing that it hasn't gone for about 2 weeks or so.
So the symptoms by and large are the same, but in some people we do have a lot of throat irritation and a persisting cough, which even continues as what we call a long COVID or a post-COVID phenomena. And we also find that some people have what we call hyperactive airways. The airways become more sensitive, and slight exposure to dust, change of temperature brings on a spasm of cough. So sometimes the virus causes, in some individuals who may be genetically predisposed, more irritation of the airways and the throat, leading to persistent spasmodic cough for many, many weeks. And in some of these patients, we've actually had to give inhalers for it to settle down. And but it does improve over the next 2 3 months. But this is something that is being observed as a part of the current variant. And I just tell my patients not to worry. It's still milder than what we saw during the Delta wave. It is causing more problem, but actually your saturation is all right. It's not causing a pneumonia. The cough will go away over a period of time.
The cough will go away. So this is generally the season. If you're in North India, at least you and I are in Gurgaon for that matter. We are here where there is pollution. People are talking about how generally things, those with sinuses, those with delicate lungs, and anyways are a little compromised. See these symptoms. So if you start experiencing some of your typical COVID symptoms, for example, you're running a temperature, you have a dry cough, and you're feeling some chills in some case that we've seen getting reported over a last few months or so. Should we be going for tests of COVID? Should we be treating them symptomatically? What's the first port of call here?
So this is an important question because there are two things. One is most people will not get themselves tested, or will get a rapid antigen test done, and if it's positive, will take symptomatic treatment, may isolate themselves, and will recover. And that is what is normally happening. So from an individual perspective, that's all right. You will become all right, and most of us, or I'll say most people, are doing that. I know a large number of people who've got their rapid antigen test positive. They assumed that everyone else in the family who also had fever, cough, and cold has COVID. They've all isolated themselves, taken paracetamol and symptomatic treatment, and have become okay. The only thing that I would like to say is that if you want to really know what is happening in our country, then they should also get the RT-PCR test done. Because if they get the RT-PCR test done, then that sample can also be evaluated for genome sequencing, and we'll know what is the variant which caused infection. Was it the older variant? Was it a different lineage? Is it BF.7, or is it something else? So that will help us as far as the country is concerned to be able to get an idea of what is the type of variants in our country as far as the current situation is concerned. But many people are not coming forward to get themselves tested. And even if they get themselves tested, it's the rapid antigen test where you can't do genome sequencing. and the data is not there. So we
Hmm.
are actually sort of looking at cases which is, I think, not correct. There are large number of cases under the radar which are presenting as flu-like illness.
Hmm.
Either may have be COVID, maybe influenza, but we don't know. But what is being done by the government is trying to encourage people to come forward to get themselves tested, and also
Hmm.
doing what we call sentinel surveillance. They're looking at hospital data. So people who come to hospital with COVID-like symptoms and are admitted, they are definitely tested. And the data suggests that as far as hospitalization is concerned, ICU admissions are concerned, that has not gone up because of COVID. And that is why one feels a little sort of reassured that although
Hmm.
you may have more cases in the community, you're not seeing more hospitalizations, you're not seeing ICU admissions. But to get a hang of the epidemiological profile of what is
Hmm.
happening even in mild cases, I would
Hmm.
say that people should go and get their RT-PCR test done.
Correct. It's a very important point. So essentially, go back to your COVID Bible 101. If you have symptoms like throat itchiness, if you are running slight fever, and any specific ones, if you want to add to that, Dr. Guleria, at this point with this particular variant, if you could just talk us through that.
So if you have fever, sore throat, running nose or blocked nose, headache, body aches, persistent cough, which is usually dry but may have a little bit of sputum with it, get your COVID test done.
Get your COVID test done and get an RT-PCR test done is what you're insisting on to ensure that this actually goes out. And because also the worry, I was speaking to a couple of other doctors earlier, was that now this is the coming week is going to be when the travel actually happens. And we know how COVID behaves. So probably from the next week is when we'll perhaps get a real picture. If somebody has to get sick, it'll happen the second week, as we know. So
Right.
January first week, would you say, is a crucial point for everybody to watch out for, also as people return back?
Yes, I think the first half of January, the first 14 days of January will give us an idea because as people travel and they come back, and then you have an incubation period, which may be 5 to 7 days, then you'll come to know if there's a surge in the number of cases as far as the travel related transmission of infection is concerned. Remember, if you look at how things started in, let's say, December 2019 and January of 2020, it started with the Chinese New Year happening, and a lot of people from Wuhan traveling to Italy and Europe and taking the infection there. And then we had this huge surge of cases in Europe, especially in Italy. So that is, and that sort of had a ripple effect for many weeks and months. So that is what we need to sort of closely monitor during the next month.
Right. Coming to then, what exactly should the government at this point? Dr. Guleria has said that they've asked for masks to be back again. There are some basic COVID appropriate behaviors that are to be followed. We saw the Prime Minister and all the leaders today in Parliament sitting with masks on. The messaging has been going from there as well. But at the moment, only random checks are happening at the airport, and states are following their specific, terminal specific or airport specific norms. Uh, would you say at this point that that's enough, or would you say we need to perhaps put in the second gear and say that all people, international travelers returning back, should perhaps be tested?
No, I don't think that would work, and that is practical. And since we know that people travel from different hubs, so it's going to be difficult to control the spread of infection if you start doing that. And we know that sometimes you have what we call the incubation period. You may have individuals who are asymptomatic, and when they enter the country, they have no symptoms, they are negative, but 5 to 7 days down the line, they get symptoms and then they get infected because they are in that incubation period. So
Hmm.
testing at the airports for everyone will be counterproductive. It will really not help and may give us a sort false sense of assurance. What we can do is encourage all people who have traveled from outside, and if they develop COVID-like features, that they should come forward and get themselves tested so that we know whether they have COVID and what is the variant based on the RT-PCR testing. I think the important thing is to encourage more and more people to come forward to get their booster shots. Again, push for COVID appropriate behavior and have very active surveillance by encouraging people to get themselves tested so that we are able to see what is happening both in the community and at a hospital level.
Right. Last question, really, Dr. Guleria, because a lot is being already talked about the booster dose, the third one perhaps, that should be coming in at this point. Adar Poonawala has tweeted about this. There are several others talking about how there is a need, perhaps. Where do you stand on this? And how does, I'm just trying to understand medically, how does it work? How many boosters can one really get? And in case, in the scenario that we were to see another wave, like you said, January first half is going to be crucial, needs to be watched out. And the onus is on us to ensure that we get our RT-PCR testing done and provide that data for the government to read those figures and understand the trends more carefully. But in case of another wave, it were to come, what exactly is the way out?
So I think we need to have very good surveillance so that we are able to pick up any surge early and take measures to prevent it from spreading and contain it, push for vaccination. And we need more data in terms of the efficacy of giving another booster dose. Should we give the same vaccine? Should we look for a new vaccine which covers the new variant? Remember, in US and in Europe, they are giving now the bivalent vaccine, which is approved by the FDA and by the European Union, which is covering the older Wuhan strain and also the Omicron strain. So, should we look at that? Although data for that is not that strong that it is making a big difference, but we wave like we do for influenza, that we have a vaccine every year, the flu shot, which is tweaked every year to cover with the circulating strain. We may have to do that, that we will may have to look at an annual booster which covers the circulating strain rather than the older Wuhan strain. But we need more data for this and to see what is the current situation in our country, what are the circulating strains, what type of vaccine do we need. Whatever data we have does suggest that even the older vaccine currently does give us some protection against the new strains also. And that is why, like I said, that those who have not taken the third shot, that is the booster dose, should come forward and take it.
Right. But all this is contingent on the virus staying the way it is right now,
Correct.
right?
So that virus is the biggest unknown and the variable that we have to factor in, both in the modeling data and the predictions for the future.
Right. And the only way to know it is to ensure that the data is provided and for our scientists and immunologists to understand this, quickly and take this forward. Dr. Guleria, thank you so much, as always, for speaking, for laying it out so simply for us. If I were to wrap up everything you've said, it would be precisely three or four things. One, there is no need to panic just yet. If you're planning your holidays, do go on those holidays, ensure that you are fully vaccinated. And there is no specific threat that is coming to kids, but the elderly are vulnerable. The second important bit is that we'll see, you're saying, a major impact if it has to go worse. We will see that happening in January first half or so. That's when the international travelers would have returned back to India, and that's when we'll see the actual impact of things. And perhaps the most important thing, if you're feeling the symptoms, please go get yourself an RT-PCR test, provide that data, and ensure that you're actually helping us and the scientists also fight this virus more closely. Thank you so much, Dr. Guleria. Thank you so much.
Thank you.